since we're picking up where the last video left off, I am getting my soap and washing the back. So I'm going to go in circular motions and clean the back. Alright, and then I'm going to clean the buttocks area. And I'm going to clean the outside. Make sure you're doing the right direction. You don't want to introduce organisms into the meatus, okay? Then you're going to lift up on the buttocks and clean the rectal area, okay? And I'm going to dispose of my washcloth in the linen hamper. I'm going to get a rinse washcloth. I'm going to rinse the back. Right, then I'm going to rinse this area, rinse the rectal area. Take a towel. Okay, now we're going to dry. Okay. Alright, Miss Smith, we're almost done with this part, okay? Dry. Okay. I'll dispose of the towel. At this point, you can get your lotion. Put your lotion on your hand. Rub your hands together and kind of give her a little back massage with your lotion. Okay. Alright, Miss Smith, hang on just 1 minute, okay? We're going to get your linen changed. Okay. Go ahead and take this. And you're going to try to roll this up as close to the client as possible. Okay. I'm going to get my fitted sheet. You want it kind of long like that. You want to make sure you get it as far enough up under the buttocks so that if they were to have a bowel movement or something that it would catch. You don't want the pad way up here, okay? I'm going to roll that up with my fitted sheet. We're going to slide that up under our dirty linen. Get enough pad up under there to where it's not all left on this side. Okay. Alright. Now I will say at this point, if you were to have feces or something on this sheet right here, I would usually take a towel or something and put it there so that it doesn't get on your clean stuff. Okay. So try to contain that so that it's not getting on your clean linen. Alright. Right at this point, I'm going to raise this side rail. And Miss Smith's going to roll towards me. Okay. Alright, Miss Smith, we're going to keep rolling over a big old hump, okay? Raise that knee up and roll, roll, roll. There you go. Very good. If you had someone helping you, they could take the sheets out for you. But since I don't, I'm going to come around. Alright, Miss Smith, almost done, okay? I'm going to roll those up and keep those away from your uniform. Put them in the linen hamper. Pull those sheets as tight as you can get them, all the wrinkles out. Pull your pad and straighten it up. Okay. Alright, Miss Smith, you're going to roll back on your back. Very good. Alright. We kept you covered. Okay. We'll let this side roll up. Okay. Alright. We'll go ahead and change your gown. Now this is a snap gown. You can see, and normally it comes like this, okay? they had an IV or something, you would just bring this snap gown up around, okay? And then you start snapping the sleeves together. Get your other arm in. Alright, we got your gown on. I'm just going to slide this little bath blanket out from under your gown, okay? But you're still covered. Alright, at this point, I'm going to change your pillowcase. If you had another pillow, it'd be better just to go ahead and change it, and then all you'd have to do is swap their pillow. But we don't, so I'm just going to, just 1 minute, Miss Smith, okay? Go ahead and take this old one off. And the best way to do it, you don't want to put it under your neck like you do your pillows at home, because there's germs. So the best way to do it is kind of fold it down like you're doing some pantyhose, okay? And then it's just going to kind of come up over your pillow, okay? Alright, Miss Smith. Raise your head for me. Alright, very good. Let me put your sheet on. You want the seams away from her skin. There's seams on the sheet. You want those away from her skin. Okay. Now I'm going to get your blanket. Let's see how this thing is done. Okay. And this is a rather large blanket, so we've had to fold it in half. The ones in the hospital are not quite this big, so we've had to kind of fold it in half for you. At this time, I'll show you how to do your little mitered corner. Please do not panic over a mitered corner. It is not the biggest deal in the world. It's just something that makes the bedding look a lot nicer. So all you have to do to miter your corner is get your sheet and your blanket and kind of lift up on it. Take and sweep your linen up under the bed. And once you do that, when you lay that down, you're going to have a little nice mitered corner there. That's going to look nice. Just helps with the presentation. Okay. Same thing here, just kind of lift up in this area. Take and kind of sweep your linen up under. And once you let it down, you'll have a nice little corner there. And I usually pick up a little bit on their feet so that it's not tight on their toes. Put my side rail up. Then you can kind of put their sheets down if they would like. Okay. Alright, Miss Smith, do you feel better? Do you need anything before I leave? Okay. I'll be back in a little while to check on you. I've put your call light right here by your hand, so you call if you need me, okay? I've got your, you gotta make sure you put your side rails up before you leave her. I'm gonna put her bed back down. Okay. Again, here's your call bell, Miss Smith. I am going to dispose of my water. Dry all my supplies. Put them in the appropriate place at your facility. Take my dirty linen to the dirty utility room in your facility. Most facilities want these hampers covered when they come out of the room, so make sure you got them covered. Take it to the dirty utility. Make sure she doesn't need anything else. I'm going to remove my gloves. I'm going to remove my gloves and dispose of those. Wash my hands. Okay, that completes your bath. Once you're completely done with your procedure, you need to make sure that however your facility documents the bath, that you go in and document what kind of bath you gave. So documentation is usually your last step that you do. If you have any questions, please let me know.